33-year-old Lydia Katende is a mother of a 14-year-old child with a disorder. When she first noticed that her son, then 4 years old, had a strange behavior, she decided to lock him in the house.
It was too difficult for me to control him because I used to feel shame.
She was more than disoriented.
It came abruptly.
39-year-old Joyce Auma lives in the Kampala suburb of Kamocha. She went through a similar ordeal with her 7-year-old daughter immediately after birth.
Seeing her that she was not like other children, I went to the hospital and the doctors told me that she had got brain damaged and in her growing she'll be slow in whatever she'll be doing.
The director of the Uganda Down Syndrome Association, Michael Okro, says this is a characteristic description of a learning disability known as Downs or Down syndrome.
In normal circumstances, all people have 46 chromosomes. Me and you, we all have 46 chromosomes. But in the case of Down syndrome, either the father or the mother releases one more chromosome, making the total 47.
The extra chromosome is called chromosome 21.
It actually disrupts the growth of a normal developing baby, actually.
This disorder has 3 forms.
The first, actually, 95% of people have trisomy 21. It's a genetic accident.
Translocation and mosaicism. Each of these forms comes with other health complications in children, with 4 in every 10 having congenital heart disease.
Which half of those people actually require surgery.
But many Ugandan parents cannot afford this. According to WHO, children with Down syndrome are vulnerable to many other diseases including hearing deficits in 6 to 8 of every 10, eye problems, intestinal abnormalities. Some have thyroid dysfunction, skeletal problems, weak immunity, leukemia, Alzheimer's disease, seizure disorders, skin disorders, and they temporarily stop breathing during sleep.
But the biggest problem is actually speech. As far as I've actually dealt them for about 8 years now.
Though incurable, there are early intervention programs that can allow many children to have a quality life and live up to 50 years or more.
So we have 2 things, education and therapy. These programs need to be actually done at preschool age, when they are still coming up. But now the problem with Down syndrome is sometimes these things are actually identified when the child has already actually overgrown that age. Then it becomes now very difficult to reverse the system.
Parents have discovered that there is comfort in numbers. Gift and Elton's mothers met with others under the Down Syndrome Association of Uganda, founded and chaired by Sami Agoya in Kamocha.
Since these children are neglected, we had a very big task. We started by giving these children some support to make the parents like them. That's accommodation, giving them some blankets, some clothes to put on.
By seeing the women who are having the same problem with me, that's how I came to know that this situation is not for me only.
They teach you how to take care of her, how to feed her.
Nutrition is another important issue to look out for amongst children with a disorder.
They can eat a lot, they have high appetite. So that eating a lot makes them actually have grow big. They have obesity actually.
One teenage girl in Australia with Down syndrome has had to cut her weight and become a model, saying exposure will create acceptance. On her Facebook page, she took control of her life with her mother's support. Many Ugandan parents, however, do not accord their children that support. The numbers are, however, daunting.
People born with Down syndrome, which we have registered now in the 5 districts, we have now 25,409. 409.
I have about 50 children here. Within, not even actually, not the whole of Kampala, within Nakawa and somewhere around Makinde.
The inclusive education system has never favored them.
These children are abused, sometimes they are victimized. So the best way forward actually for these people is to get a school for them, which I'm really trying to struggle for.
Certain parents have a higher chance of having a child with Down syndrome. The probability of getting it arises when a woman is above 35 years old and the man is above 50. It occurs in people with a family history of Downs. Some of the visible signs include:
you can get somebody with small mouth cavities. They have some round heads. you find the neck is actually sometimes it is a flat at the back, the head. And they have sometimes short hands and short fingers. That sometimes make them quite difficult to perform their duties.
Some have squinted eyes, bulging tongues, large spaces between the big toe and its neighboring toe, oddly shaped ears, and poor muscle tone. They really do require adequate attention, including love.
And they like music. If you want to see them in their true colors, you put there some music.
Lydia has had to learn to work from home.
Like a poultry keeping, making candles.
Joyce too has resorted to doing this.
It needs you, the parent, to take care of her.
This is a commitment they have to give their children throughout their lives. Florence Nalimba, NTV.
Her gift because